Joining me now is Shefali Luthra, a correspondent with Kaiser Health News, just the person I want to speak with to help us sift through all of these different proposals. Thanks so much for joining us. We heard the last two nights some real differences between the various candidates, especially when it comes to private health insurance and whether that should be completely eliminated. Before we go any further, can you just give us some context? How many Americans have private health insurance, and where does the American public stand on eliminating private health insurance?
So private insurance it's a huge part of our healthcare system. More than 50% of Americans use private health plans. About 49% get them through work. Maybe 7 or so, these are 2017 numbers, but the best we have get them from the exchanges. And those are a lot of people who, some of them don't love their health plan, some of them do. And the idea of eliminating private insurance is not that popular. We see Medicare for all as an abstract idea, polls quite well, but when you tell Americans private insurance would be gone, support drops to around 37%, which is, significantly lower than what you would have expected otherwise.
And so what could eliminating private insurance mean for healthcare as we know it?
It's a really big change, and in some ways it's really hard to conceive. So if we think about what Medicare for All promises, right, it would in some ways offer us something much more generous than what Americans with private insurance are used to, right? There would be no copays, no deductibles, no cost sharing really of any kind, and every medically necessary service would be covered. On the other hand, you have to trust that the government would actually give that to you and would be able to deliver on this health plan that it's promising, which people aren't always sure the government can in fact do. And the other thing to think about, though, right, is under a single payer plan, no private insurance, you wouldn't, something like a surprise bill, an out-of-network doctor wouldn't really be a factor, right, because everyone takes the same health insurance.
And you kind of touched upon this, but we've seen some candidates say they don't support Medicare for all, saying, hey, it would eliminate private insurance. Clear this up for us. It would do that, but there seem to be differences of opinion on that last night and the night before in terms of a transition of sorts to a single payer system.
So there are a couple of points here that I think are worth clarifying. One is that under the Bernie Sanders Medicare for All bill, private insurance could in theory exist, but it would have a very, very small role, right? It would be legally prohibited from competing with the government plan. So it could cover what Senator Sanders says is mainly cosmetic procedures. It might exist in a very small form, but how meaningful you think that is in some ways maybe not as important to debate. The transitional element that you talk about, right, is what we think of as a public option. And there are lots of ways you could go about providing a public option. Maybe on the exchanges, maybe not, but the idea is that the government would offer this, what Mayor Buttigieg called Medicare for all who want it, right? You can sign up for this Medicare-esque plan if you choose to, or stick with your private health plan. And the argument goes, if it's run really well, more and more people would opt into that instead, and ultimately it would make a more natural transition into a Medicare for all or single payer type system.
And then we've also heard some of the candidates say with that transition, that may require insurance companies to be more, private health insurance companies to be more competitive and lower their rates, right?
That's Senator Gillibrand's argument. That's a very conceivable path. It's really hard to say, right? We haven't tried something like this before. We don't know what would happen.
And if one of these candidates is successful in beating President Trump in 2020, it's not like they can just be able to implement Medicare for all or any of their other health care proposals. They need to work with Congress. What are some of the challenges there?
I mean, the big one, right, is you would need a Democratic majority in Congress, which good luck to you. That sounds like, something to think about how you would get there. You should talk about the filibuster and whether you want to keep the filibuster or not, which is a very divisive conversation amongst Democrats running for president. And then you think about other things. The current Medicare for All bill would cover all abortions. That reverses the Hyde Amendment. That is intensely politically polarizing. I mean, what stays in, what comes out. Bills change a lot when they're going through Congress, and it's hard to imagine that what we see here would be ultimately what we would end up getting.
So many things to consider. Obviously, we got a long road ahead before the elections, even the primary votes begin.
Goodness, yes.
So we'll be hearing much more about this. We will definitely be following your work, Shefali Luthra, a correspondent with Kaiser Health News. Thank you so much for joining us.
Thank you for having me.